and it is defined as a journey, and religion may be the transport to get us there. But essentially, the most basic definition is really relationship with self, others, environment, with God, or whoever you consider to be a higher power. Cancer or end of life illnesses does break your spirituality and your wholeness, because wholeness and spirituality is there to help you to fulfill specific needs. What does your life mean? What is it that you're going to do? What are going to be your daily habits? It provides you with psychological support with a group of like-minded people. It could be church, or it could be people who don't believe in God, but they go and they find joy and satisfaction in the environment. And we're having more and more of those people. So a lot of times we, as traditional Christians or traditional religious people, we don't seem to include those in there, but those persons do exist. So spiritually helps us to give us support. And in the case of this lady, they testify that she had unwavering spiritual resources. It might include religion, but it might not. Next slide. What every patient wants is to have restoration of health so that they can finish goals. Maybe like this lady, she wanted to finish her will. She probably wanted to meet with her, not probably, she wanted to meet with her family again. Hope for her, she had hope. So she was hoping for a cure. And so maybe that didn't happen. So she was hoping for time. And then eventually she wanted to hope for peace. And the peace meant that it didn't satisfy what the medical people were doing. And because maybe she didn't find the space to do all of this, so she wanted to go outside of that environment. And sometimes physicians have to, that's where the chaplain comes in very important on a team, or somebody who has that insight. And palliative care is bringing a lot to the table. Compassionate care is not to fix the problem, but to witness being there for the one who is suffering. Next slide. So, hope timeline, suffering and hope, and the timeline. Usually, when the patient is just diagnosed, they hope to be completely cured. And sometimes they are in denial. So, they will say, I'm not going to go back to the doctor. I want to go to do alternative medication, something, because I believe in God. But with time, it becomes terminal. Then they're asking for more time. And instead of hoping for cure, they're trying to find a way to be comfortable and pain free. In the case of this lady, she wanted to die in a peaceful and maybe not pain free, but comfortable in terms of what she wants. One of the things that we have to be careful about hope is not to give people false hope. And with this, I caution you about the persons you use as chaplains, because I must indict my own profession for giving people false hope and saying you shall not die, but you shall live, and all kinds of other things that are not always helpful to the patient and causes lots of devastation. Next slide. All right, so this is just a recap about spirituality. It's not about denomination, but it's really a time when people can get in touch with their spirituality. Sometimes people become stronger, but there are times when people are angry. This lady was not angry, but a lot of times people are angry, especially when they're waiting for a cure, or they say God has abandoned them. Next slide. So when a patient is at the end of life, there are coping strategies that they try to use. Some of them have church communities or faith group communities that help them to pray or help to fast for them. And prayer is the most widely and most well used coping strategies for all patients, as we know, for majority of patients. But there are others: fasting, reading sacred writings. I'm sure this lady had that done, lighting of candles, listening to inspirational music, chanting, engaging in meditation. And there are other communities that do other things. All right, spiritual care, as we know it, is to practice compassionate presence. So again, it's not to fix it, but to journey with them to find out what are their fears, their hope, their pains, their dreams. And this team did well again, because the details, just the presentation, tell you that they have been doing a lot of work. So they knew what she wanted, help her to write her will. Obtain a spiritual history, they did it, although there were no chaplains there, because it is true that you as a nurse or a doctor can do it. And later I will show you a model that I've been using. They are attentive. Spiritual care means you're attentive to all the dimensions of a patient, um, pain and what's going on with them, but also with their family. And then you have to, part of what most don't do, and I include this, that we can always make sure we include a spiritual care worker into the interdisciplinary team. Next slide. And this is just the role of a chaplain to explore meaning and purpose for the patient and family. So those of us who don't have chaplains or spiritual care worker, I'll be happy to train some of them because there's a lot of work to do, and to provide grief and bereavement support for families with serious illness or who are facing end of life issues. Next slide. And this is just a breakdown of the goal of a spiritual history is just to listen to the patient fears and hope, to open up communication about how they want to be treated. So yes, this case did well to find out who she was in terms of spirituality. She had strong inner resources, but maybe a little bit more exploration would have, it would have unearthed the reason why she wanted to leave, and it could have been a softer discharge, or more could be done from the hospital end. Help to bring compassion back to medicine, taking care of the whole individual, which includes the spiritual part of it. Help to bring dignity to medical care and to improve patient trust. Or you could talk to the patient, you could talk back, you have a better understanding. And the more you talk to them, then you know, have a better idea about what are some of the religious or cultural practices that will impact medical decisions. Next slide. Sometimes we have objections, or we, maybe it's not the objections, but sometimes people are not able to do spiritual history, not the chaplains, but this healthcare worker, because of lack of training, lack of time, or lack of private spaces, lack of experience taking the histories. And they also have a difficulty identifying patients with spiritual issues. Again, I'm offering that I will do some training online with some assistance, so we could have some of our healthcare practitioners do this. Now, this tool here, we have FICA, which a lot of people I think I know that we use as a spiritual assessment tool. When I worked at Hope with Dingle in an acute care hospital with cancer patients, a lot of times people could not identify, although there are some persons who are laden with religion, but there are some persons who could not understand and identify with the concepts as it comes from Christianity because they never knew it, or from any kind of religion. Next slide. So what I did was to, next slide, what I did was to put together a spiritual assessment tool that kind of strips away the religious pieces so that they mention it and they bring it, and then we can treat with it and to do the affirmation. So it is called the 3C assessment tool, spiritual assessment tool. And so the doctors and the nurses, the social worker can use it too, because it's just a screening so that you can have a good idea as to what's going on. First phase, what is the crisis? Who or what are your connections? And what is your care plan? So those are the first set of three. The second set is, was the care compassionate? Was the care collaborative? What are the care gates that were open? So anybody can do this. They ask questions that you don't have to know a lot of things about religion. You are simply just doing a history, like how you do a social history, except it is in the spiritual domain. So let us just look closely at what it means. So for each person who comes in facing end of life or having any kind of illness for that matter, they have some kind of crisis or issue, spiritual crisis, isolation, fear, grief, loss of faith. We have met them. Then you want to find out from them who are their connections. This lady had a husband who, although the relationship was strained, now a sister, she had her two friends who were in the community who became her friends through church connections. All right. And then the care plan. What were the practices? She said what she wanted to do. She said that she wanted to, she didn't want to comply with more adding more morphine. So that's the care plan. So when you do this, you're asking a series of questions or unearthing answers from them in terms of how they want to be treated, who are the connections, so you know who to connect, and what are the crises that they have. That can give you a lot of information as you're working with the patient. Next slide. And the second slide is for the patient to ask, but is also for you to ask, it's almost like an assessment piece. What I did, was it compassionate? Was it done with dignity? Did I communicate? Was it sensitive? Did I show care? Was it collaborative? Who were my referrals? Who did I consult? In this case, I consulted family. They had family meetings. They had friends. They even spoke to the herbalist assistant because of the concern that they had. So if you're able to do something like this, then I believe it's a good tool. And I know, based on using it, that along the way, all the persons who have religious background or strong religious belief, they will always bring up God or whoever they consider is a higher power. And then the care gates. So she had hope. She had hope for care. She had partnership with family members. She had partnership with her friends. So I invite you to use this tool. Most people find it fairly easy to work with. And it also is not judgmental, because a lot of people are not practicing Christians and sometimes they feel timid in working with you because all the religious covering that there is. So for suffering and hope, people at the end of life really do go through a lot, and it is always very important to explore the spiritual connection in these cases so that you're doing a holistic care for the patient and the family. Thank you.